The Health Camp of New Jersey, HCNJ, marked a significant milestone on November 19, 2023, as it celebrated 25 years of unwavering community health service at the Balaji Temple Auditorium in Bridgewater. Attended by over 400 individuals, the Silver Jubilee Gala not only recognized the organization's rich history, but also served as a platform to raise funds for a groundbreaking initiative, a community health center in New Jersey by 2026. The gala highlighted key achievements, including the recognition of lifelong dedication by volunteers Dr. Ashok Patel and Naveen Mirai, and featured testimonials from youth volunteers, emphasizing the transformative impact on their lives and careers. Dr. Tushar Patel, president of HCNJ, outlined the vision of the new center, emphasizing collaboration, early intervention, and addressing healthcare disparities affecting the uninsured and underinsured. The event received notable support from government officials, sponsors, and the community, underscoring HCNJ's commitment to reducing healthcare disparities and providing essential services to those in need.
Good evening. It is my pleasure and distinct honor to welcome all of you to Health Camp of New Jersey's Silver Jubilee Gala. You know, if you think about it, Silver Jubilee, 25 years, is a huge achievement for any organization. And it has a special importance. Why? Because it signifies coming of age and maturity. What we have done over the 25 years is phenomenal, thanks to literally hundreds of volunteers who have served this community so well. So give them a big, big round of applause. You know, the whole thing started with a very simple idea. Our founders, what they wanted to do was to offer comprehensive health screening to uninsured and underinsured individuals. That's it. But the most important word here is comprehensive. So we did not just give information about the healthcare industry and how and what to do. How many are here who have not heard about Health Camp of New Jersey? Oh my goodness, that's fantastic. Most of you have. That is awesome. But anyway, I'll give you a patient's journey at Health Camp of New Jersey. Patient walks in, they register. First, you know, they are fasting, so we do the blood test. And then we have number of other things like blood pressure. Then they go and have EKG done. They have their eye test, ear test. We don't stop there. We feed them breakfast because again they are fasting. Then the next step is we have a number of physicians who provide pro bono service for us. So there are internists, so the patient has a consultation with an internist. They get their EKG, we have cardiologists. As a matter of fact, one of our original member, Dr. Ravindra Patel, he's here. Ravindra, why you're here? Please stand up, give him a big round of applause. He was our first cardiologist, and they look at their EKG. If there is any abnormality, of course, they guide them. And we don't stop there either. There are dietitians who offer a diet, consultation about your diet, what you should eat, what you should not eat, based on what condition you have. We have mental health experts who provide consultation about if you have mental health issue and substance, issue. So this is what we mean by comprehensive health screening. And once the blood test results come, we send it out. Now it's all digital. We send it out, and our president, Dr. Tushar Patel, is phenomenal at doing this. We send it out, and then they get the results, and so they find out. So let me give you a number which is astounding, and we are so thrilled and happy about it. Over the last 25 years, we have seen and screened over 12,500 patients. I call it, we call it, the technical term is comprehensive health screening. I call it an annual health checkup. If you go for an annual health checkup, what we do will probably cost you well over $1,000. Multiply that by 12,500 people. Health Camp of New Jersey, which used to be Indian Health Camp of New Jersey, has provided over $12 million of free medical services. $12 million. That's what we do. So the idea was this, there were three really good individuals. They were our founding members. Jitendra Fadia, he was the one who really thought about this idea. And then joined him were two other, a lovely couple, Subhash and Pushpa Amin. Jitendra Fadia unfortunately could not make it here today, but he is like the father of this organization. He did so much for this organization that we cannot thank enough. And I want all of you to give him a big applause for the seed that he planted, which has now blossomed into a phenomenal large tree. The other two individuals, Subhash and Pushpa Amin, this week has been a very difficult emotional week for those of us who have been affiliated with Health Camp of New Jersey, because just this week, Subhash Amin had a massive stroke, and unfortunately, he did not make it. But knowing him, and I talked to Pushpa Amin today, and she said, continue doing what you are doing. Don't stop doing because some adversity comes your way. Celebrate your 25th anniversary. And I can see Subhash Amin looking down at us and showering his blessings to all the volunteers and our entire team. He was really a quiet force behind the success of Health Camp of New Jersey. And let us take a moment to thank him for what he has done and his lovely wife has done. Give them a big, big round of applause. I would not be standing here. We have learned so much from all three of them. And they continue to guide us, and I'm sure they will continue to guide us as we move into the future. What they wanted to do was really reduce the disparity. There is a big disparity between those who have insurance and those who do not have insurance. Well, they tried, and Health Camp of New Jersey tries to reduce that disparity so that those without insurance can have better lifestyle. They find out and they get diagnosed for any abnormality they have. So one thing we found out over the years is out of the 12,500 patients we saw, almost 1/3 of them had some abnormality. And that's what keeps us going, because now those patients had an opportunity to have early detection and hopefully cure the problem they had. That's what is so important, that we continue doing this, we sustain this program. But I'm going to let Dr. Tushar Patel give you more details about the clinical side of it, and he's going to come on in just a couple of minutes. So let's move forward with our program today. It's a momentous occasion, and clearly we celebrate all the work that has been done by so many volunteers, as I mentioned. So at this time, we want to honor a couple of our special individuals of our team. First one is Mr. Naveen Merai. He is a long-term devotee of Sri Swaminarayan Mandir in Secaucus, New Jersey, and he has a huge team at Secaucus Mandir. We do one health camp every day. He's such a meticulous individual. Every patient who came in has to first see him and register with him. And he gives them proper guidance so everybody knows what's going to happen. So let me please welcome Mr. Naveen Merai. Please come to the stage, and I request Dr. Tushar Patel to please. In addition to that, I'm also requesting two of the temple's management team, I'm talking about the Secaucus Temple's management team, to please come and be a part of this ceremony here. Dinesh Patel and Kamlesh Patel, if you can please come to the stage. Okay, I'm told that Dinesh Patel is not here, but Kamlesh Patel, if you can please. So we are giving him a plaque from the Indian Health Camp of New Jersey. I keep saying Indian Health Camp because we just changed the name, so please, I apologize for that mistake. But we are also honoring him with a special certificate and an award of volunteer award from the President of United States and a letter from the President of United States, Biden, and a medallion. Ladies and gentlemen, and many of the volunteers, they come to one camp which is close to their home or something. Kamlesh Patel, are you here? Oh, no, I thought Dinesh Patel is not here. Okay, yeah. But he is there at every one of our camps. I would say he has seen more than 10,000 of those patients. Give him a big round of applause. Naveen Bhai, thank you very much for all your service. It's a Lifetime Service Award. Thank you again. Another similar individual is Dr. Ashok Patel of Medicor Cardiology. Give him a big round of applause. He's a cardiologist. He's been there since almost the very beginning. I still remember one camp where we had over 400 patients and he looked at 400 EKGs. That's the kind of dedication he had. This is all pro bono, ladies and gentlemen. Medicor Cardiology also has been tremendously helpful to us because Ashok Patel, in those initial days, we did not have EKG machines. He brought them with him from his office. He brought the supplies needed. And again, we thank Medicor Cardiology also for that. Dr. Ashok Patel, he was supposed to be here. Again, we are giving him the same award, Lifetime Service, as well as letter from the President of the United States and the Certificate of Volunteerism. Accepting so last night he called us, and unfortunately he was so, very excited to come here, but he was tested positive just last night. So he's unfortunately not here. However, I request Dr. Rachna Kulkarni to please come to the stage and accept the award on his behalf. Rachna is the senior partner, and I'm not sure whether her title is president or not, but I think everybody knows Dr. Rachna Kulkarni. Yeah. And I request 3 of our executive committee members to please come and present the award. Dr. Sunil Parikh, Dr. Shefali Patel, and Mr. Subhash Shah. You can wait for this. Dr. Kulkarni, please let Dr. Ashok Patel know that we really missed him today, and we thank him for his services. He was like, if he was at a hospital, at Health Camp of New Jersey, we didn't have titles, but he would be like a chief medical officer of a company. That's what he was. That's who we feel he was. Thank you again, Dr. Patel and Dr. Kulkarni and Medicor. One of the other hospitals that has been a collaborator and big help to us at our camps is RWJ Barnabas Somerset, which is right in our backyard here in Bridgewater. They are in Somerville. When we have health camp at this temple, they don't send just 1 or 2 people. They send an entire team. There are people who take blood, they will do the blood pressure test, they will give vaccines, they will have so much information material, and almost 8 to 10 specialists. I'm talking about oncologists are there, cardiologists are there, dietitians are there, you name it, they are all there. So we really appreciate all the help that we have received from RWJ Barnabas, and we want to honor them for their tireless effort in reducing the healthcare disparity. That's what they also believe in. And I want to welcome a representative of RWJ Barnabas, Sejal Dave Sharma, who is the Director of Business Development, to please come and accept the award on the behalf of RWJ Barnabas. Sejal, can you please come? And I request Ritesh Shah and Dr. Rupen Parikh to please come to the stage and present the award. Thank you. And Dr. Tushar Patel, I really want you here too. Thank you. Give them a big round of applause. They have been a good partner for Health Camp of New Jersey. And please convey our message to your leadership team also at the top that we appreciate what RWJ Barnabas does for us. Thank you. You know, in order to sustain for 25 years and longer, you need one important thing. You need to have a new generation of, in our case, volunteers who come forward and do what we have been doing and help us. And to that end, I want you to hear from 3 young professionals. Now one is a physician, two of them are physicians already, and one is, I think, in pharmacy. Correct me if I'm wrong after I'm calling you. They have done a phenomenal job of volunteering for us. And I want them to come here and say in their own words exactly what it has meant for them to be part of being a volunteer and how they will continue their journey with Health Camp of New Jersey. Please welcome Dr. Ninad Desai, Dr. Tushar Mahendra Patel, and Niyati Patel. Guys, come over and oh, you're here, Niyati, yes. So actually, I'll ask Niyati to take the stand first. Ladies first, guys.
Good evening, ladies and gentlemen. First of all, I would like to congratulate the entire team of the Health Camp of New Jersey for completing a successful 25 years. Today, I stand before you to share my incredible experience of volunteering at the Health Camp and how it shaped both my healthcare career and my overall development. When I first joined the Health Camp of New Jersey, I was eager to contribute my skills and knowledge towards providing healthcare services to the underinsured or uninsured communities. Little did I know that this experience would be a very transformative one for me. I started volunteering with the Health Camp of New Jersey back in 2012. Upon starting my volunteer work, my duties at the health camp included of inputting patients in the laboratory database, ensuring the accuracy of their system, aiding in arrangement of various physician stations, and providing assistance in any way needed. I had the opportunity to assist healthcare professions in conducting medical screenings, providing vaccinations, and educating individuals on preventative care measures. This hands-on experience gave me an invaluable insight into the challenges faced by the community. So volunteering at the health camp allowed me to witness firsthand impact of healthcare disparities in these populations. I had the opportunity to work with a diverse team of medical professions and passionate volunteers, all dedicated to making a difference. It was a humbling experience that reinforced my commitment to pursuing a career in healthcare. Furthermore, I would like to mention that volunteering at the health camp helped me develop crucial interpersonal skill. As being in the healthcare industry, it is very important to effectively communicate with patients. So this helped me a lot with the interpersonal skills. Volunteering also exposed me to the importance of collaboration and teamwork. In a setting where resources are limited, I witnessed firsthand how a group of dedicated individuals would come together to create a significant impact. Collaborating with fellow volunteers and healthcare professions taught me the power of synergy and the ability to achieve more collectively than I could ever do alone. Beyond the realm of healthcare, my volunteer work at Indian Healthcare enriched my life on a personal level. It provided me with the profound sense of fulfillment and purpose, knowing that I was making a difference in the lives of those who had limited access to healthcare. Overall, my experience of volunteering at the Health Camp of New Jersey has been instrumental in shaping my healthcare career and my overall development. Most importantly, it reaffirmed my passion for serving others and making a meaningful impact on the lives of those in need. I wish to continue to serve Indian Health Camp of New Jersey in future as well. Thank you so much.
Good evening, everyone. All right, I'll just hold it. Good evening, everyone. Thank you all for attending the Health Camp of New Jersey's 25th Anniversary Gala. First and foremost, congratulations to the Health Camp, its founders, its board, and all of its volunteers on 25 years of remarkable service to the community. It has been a privilege, I say privilege, to be a volunteer for the Health Camp since 2006. I say privilege because the volunteer work that each one of us does in this room for this great organization is not only an act of kindness, but an act of love. Because most of us in this room are privileged enough to have the ability to teledoc a physician or run to our nearest urgent care when we need. However, our patients do not. We provide care and comfort to them, reassuring them about their health and providing excellent preventative care services. We follow up with them, refer them to expert physicians and specialists, and stay in touch with them because over the years, our 12,000 patients have now become our family. Health Camp of New Jersey provides the opportunity for its volunteers to do God's work, to serve the most underprivileged moms, dads, grandparents, aunts, uncles, relatives, and friends in our community. I started volunteering when I was 13 years old, and to see the remarkable growth of the Health Camp of New Jersey is astounding. From each year, the patients just grow more and more. The organization continues to partner with new community organizations developing bold new initiatives, including building the first community health center of its kind. For those who don't know, I'm Mahendra Bhai's son. That's my dad. He's out of town this weekend, but he wishes you all best wishes as well. Let us all come together and pray for the Health Camp of New Jersey's continued growth, success, and service to the community. Looking forward to many, many more anniversary celebrations. Thank you.
Hello, everyone. My name is Ninat Desai. I'm an emergency room physician in New York City. And I just want to say I've only volunteered with the Health Camp of New Jersey for the last 5 years, but it has been an incredible privilege. So first of all, I just want everyone to clap one more time for the incredible work we've all done for the community. So just to give you guys a little bit of a primer on who I am and why I do this. My mom, Shailu Desai, who's here from Gujarat Times, has always been in news media. And so when I was about 9 or 10 years old in India, I went with her on one of her interviews to the very first school for the mute children and the blind children in our city. And that's the day that I saw, during their recess, kids having so much fun without making any noise whatsoever. And that's the day I was introduced to the concept of privilege and luck and good health and fortune. And all I've wanted to do my whole life was to give back to the people so that they can have the same quality of life that I do with my privilege, my good health, and my good looks. So, joking aside, I'm honored to be here, and I hope that I can contribute now and forever, as long as the Health Camp of New Jersey is around, and to their community center, and hope to collaborate with all of you to continue giving back to our community. Once again, thank you for having me.
Do you see the reason why Health Camp of New Jersey is going to continue to have incredible success? You just heard from 3 individuals. We have many, many more physicians like them, and healthcare professionals, and just volunteers who are willing and ready to help us. So we will be able to sustain for a very, very long time and continue to serve our community. At this time, thank you. Oh, they're gone. Okay. I don't have eyes in my back, that's what happens. Yeah, I know, right? It's all good. So at this time, I want to introduce a very, very special person. I think he has taken Health Camp of New Jersey to the heights that I don't think even our founders had imagined. He's incredibly hardworking. He's a physician. However, I don't know that many physicians who are also good at administration. He's good at both. I mean, he's fantastic at both. And that's a unique quality a medical professional has. I know some others who also have that. But he is president of Indo-China, Indo-American, I need to wear my glasses, I think. Hold on. You know what? I should have written them in large letters, but I did not. Indo-American Cultural Foundation, he's president of that. And he's president of SGMLI Hospital, USA. He's so good at it that I think President Biden should appoint him as a health czar or something to do something there, right? Please welcome a dynamic individual, a phenomenal hard worker, Dr. Tushar Patel. He's the president of our organization.
This journey, which started with a simple goal of providing basic health screening, chronic disease prevention, education and counseling service in 1998, has reached its 25 years of milestone this year, 2023, with more than 12,500 individuals served and 4,000 chronic disease abnormalities detected. Our dedicated team of volunteers has saved lives and reduced healthcare disparities across New Jersey. They have donated countless hours on Sunday mornings away from their families and leisure time to provide their selfless volunteer service, some for over 2 decades. If you are a volunteer of Health Camp of New Jersey, please raise your hand. Our volunteers deserve a big round of applause. Please give it up for this wonderful team. Good evening and welcome everyone to our Silver Jubilee Gala event this evening. A special welcome to all our invited guests and elected officials from county, local government and state government. My name is Dr. Tushar Patel, President of Health Camp of New Jersey. On behalf of our executive committee, trustees, and the entire team, it is my immense pleasure and honor to host you all for our 25th anniversary gala here at Balaji Temple in Bridgewater. As we approach the quarter-century mark of the 21st century, our healthcare challenges are growing immensely. And as we all witnessed during the pandemic, we lost our focus on preventive healthcare over the last 3 years. Thankfully, we are back on track, but access to the healthcare system for uninsured, underinsured, and underprivileged individuals is still very challenging, and we all collectively need to work toward collaborating our healthcare delivery system and efforts to provide basic health screening to detect chronic diseases earlier for timely interventions and better outcomes and to reduce healthcare disparities in our community. So at this milestone event, we are committed to starting a new initiative, opening a community healthcare center in New Jersey. The Community Health Center project will be in collaboration with our community leaders, partnering organizations, and healthcare institutions in New Jersey and beyond. This is not an overnight idea, but a well thought out and carefully planned idea. I remember a meeting held with few of our healthcare leaders across our community about 15 years ago to start a community health center focused primarily on South Asians, but unfortunately it did not materialize that time. It is clear now, time is now. As the healthcare disparities are at their highest levels across the nation, and New Jersey is no exception. With your support and a team of strong, dedicated, and hardworking professionals, we are ready to take the challenge to meet our goal of a community health center opening in New Jersey by December 2026. Of course, the road ahead will be very challenging, as we know that anything you do new is always challenge, but just like we beat the odds by providing health screening for the past 25 years, we are confident that we will also meet our goal on or before December 2026. The plan is to find a place in Central Jersey area where a large number of minority populations reside. I am happy to see our good friend, Edison Mayor Sam Joshi is with us. And I know that he will be very instrumental in providing his support, and we're looking forward to your support. We will start a small center and grow bigger as the needs increase. Initial planning is to have support from donors like you here this evening who can generously contribute to start our project. During this time, we can also start working on the federally qualified health center or look-alike center in the state. As we know, anything to do with government requires a lot of documentation and past history, which we have demonstrated for the past 25 years already. We are ready to embark on the process in the near future, which can take up to a few years to get approved, but we don't want to delay the process any further. And that is the whole reason we are having this fundraising gala, 25th anniversary gala event. We intend to start working on the initiative on our own as early as next week. So a new journey begins tomorrow, and you all are invited to join us on this wonderful ride of giving back to our community as part of our great team. This center will allow us to provide additional year-round services, including consultations, follow-ups, vaccinations, medications, and many other medical, dental, and mental health services to help reduce healthcare disparities in our community. Finally, I would like to extend my sincere appreciation to all organizations and institutions that helped us in our mission for the past 25 years, and I hope to have their continued support in the future. I would also like to express my sincere appreciation to all our sponsors, donors, and supporters for their continued support in our mission and for making this evening a memorable one. I'm happy to see our community healthcare partners join this evening: RWJ Barnabas Health, Somerset, Asha and Ritesh Shah of Ritesh Shah Charitable Pharmacy, Dr. Makhija and his Samin mental health team, Dr. Mehrotra and his SKN Foundation, Dr. Gore and her Sathi team, and our health fair collaborating organizations, Balaji Temple, Bridgewater, Swaminarayan Temple, Secaucus, Durga Temple, Princeton, Swaminarayan Temple, Weehawken, Santram Bhakta Samaj, and Christina 6 Academy in Trenton, who are present here this evening. We are so thankful to all of you for your commitment and for partnering with us. Without your support, this journey would not have been possible. Special thanks and sincere appreciation to the management of Balaji Temple for their continued support for the past 25 years, and providing support, resources, and wonderful collaboration with us to make our health fair a huge success every year. Please give it up for Balaji Temple Audit. And lastly, special thanks to our media partners, Dr. Sudhir Parikh. Parikh Worldwide Media is here. Thank you so much, Dr. Parikh. HR Shah of TV Asia. Kalpesh and Shubhas Shah of Gujarat Darpan. Radio Zindagi, EBC Radio, Indus TV, Hi India, The Indian Eye, India Abroad, Akila News, and JSW TV. A special shout out to our digital media partner Vibrance, and photo and videography support by Chirag Patel of Universal Photography. And lastly, to our entertainment, Unlimited, Mahesh Mehta and his team, a musical band, and we have a surprise playback Bollywood singer entertain this evening. Thank you so much, everyone. Let's enjoy the rest of the program. I would like to invite back Kiran Kothari on the stage.
I know my job, and I don't want to waste your time, that's for sure. I know it's already a little long, but we really do want you to know what we have done over 25 years. And we want all of you to think about joining our team. Whatever expertise you have, come and help us. But at this time, let me find what I'm supposed to do. We had a change of order, so I want to invite, I think Dr. Tushar Patel just mentioned, Mayor of Edison, Sam Joshi. Can you please come to the stage? I'll make a very quick introduction. He was born and raised in Edison, which is the 5th largest municipality in New Jersey. At a young age of 27, he was elected as at-large council member. And then he was elected as the mayor. He joined the council in 2017, and then just recently he was elected as mayor. Ladies and gentlemen, a few words from Mr. Mayor Sam Joshi.
Thank you. Good evening. I'm truly humbled and honored to be here right now before so many individuals, so many giving individuals and dignitaries as well. I want to first acknowledge the mayor of Bridgewater and his family. Thank you for having me in your town, Mayor Mensch. As well as so many other elected officials. I see commissioners and state legislative members here. So many doctors present from the Indian Business Association, my dear friend Rupen, and I see so many other friends that are in the room right now. And of course, my wife. Thank you for coming out today. But it's truly a humbling, I'm humbled and honored to be here right now because of the type of work that each of you do. And as I was listening to these stories and I was listening to the doctors speak directly from their heart about your mission statement, I wanted to share a story about myself and why I'm so passionate about healthcare and healthcare policy and making sure that those who are underserved get the type of coverage or screenings that they deserve and need, quite frankly. I'm only 34 years old, but it doesn't change the fact that there was a moment in my life where I had a gap in coverage and I did not have health insurance. And it just so happened to be at a time where I had an asthma attack. I have asthma and I have allergies. No secret about it. Actually, Dr. Parikh used to be my doctor. But during that time that I had my asthma attack, in that gap in coverage, I ran out. And fortunately, I realized in that moment that while I was thankful, especially with the Indian community, we made some phone calls, and at that time I received a free sample for an inhaler. I was fine. But stop and think about how many thousands, how many hundreds of thousands, if not millions of youth and adults across the world, but right here where we live in the United States, also do not have coverage, also do not have access to healthcare. See, we within the South Asian, the Indian community are blessed because I was able to make that phone call in that moment where I needed an inhaler so that I can breathe. And I did so just because it was my family friend who happened to be a doctor. Gave me a free sample that day. Within hours, I got that inhaler. But across the United States, there are countless families that are struggling with not just asthma like myself, but diabetes or so many other medications that they just need in that moment. And it's that moment where, while the speakers were giving their stories and sharing their own personal stories, I always remember that doctor that was there for me in that moment. And as I look around in the room right now, I think of each of you. Because you're there so selflessly, in such a giving way, giving back to the community, ensuring that people that deserve healthcare, deserve the right to access to healthcare and the screenings that they need, also receive it, so that that younger version of me can also be taken care of just like I was. You're doing that same work. I thank you all from the bottom of my heart. Although many of you here may not have, helped myself, but just stop and think about the type of work that you're doing. And it's truly commendable. And I look forward to helping in whatever capacity I can, whether it be as mayor or just as a friend or a colleague, making sure that the federally qualified health center that you are working towards, or a comparable one, starts right here in New Jersey and hopefully in Edison. Once again, thank you all for doing the type of work that you deserve. I'm truly humbled and honored to be here. Thanks again.
When we started talking about opening a health center, we had a big volunteer appreciation dinner evening. And we, estimated what our cost would be to sustain it until we become federally qualified. So there is one special couple, individual and couple. He was sitting there. He has one of the largest engineering company in New Jersey. And he came to the stage and he says, I wish I was a physician, then I can help you medically. But you know what I really do know is foundations, and foundation of any organization in this case. So he came forward and he said, what is your initial requirement? What are you raising? He said $600,000. Without even asking him, he came to the stage and said that I will donate $150,000 as a down payment, which will be a foundation to start the health center. And that is none other than incredible philanthropist, Mr. and Mrs. Atul and Lata Shah. Can you please come to the stage? He has literally, changed the definition of philanthropy. This is not the only organization where he comes through and offers help. He has done so many things for so many of not just Indian community organizations, but all over New Jersey and worldwide. Please give him a big round of applause, Mr. and Mrs. Atul and Lata Shah. So we're going to present him a plaque, but I'm also going to ask him to speak. But, he brought something special with him. So we're going to bring a check. Thank you, Jigisha. I appreciate it. This is a check in the amount of $150,000. What he wanted to do is inspire others to join him. And at this time, I request Atul Shah to say a few words. You know, he's part of our advisory board members, but he's so passionate about it. Mr. Atul Shah.
Good evening, everyone. Surprisingly, looks like everybody's doctor. I'm the only engineer, but I think when you look at the cause and what they do, looks like I'm from the kindergarten, and these are all from the PhD students. The amount of work and things what they do, and they save lives. On June 11, during the 25-year appreciation, when they say that we need help, and it just came to my mind that what is really the value of life? It's really, really, no one can put a price to it. But whatever we can do to help them to get this off the ground, this is where I need your help. So what I'm thinking is that if everyone in a family, husband and wife, if you can donate $250 per year, family of 425, $500, okay, per year, 2 years, 1,000, we only need 1,000 couple to make it million. Remember this. We have Somerset County, Middlesex County, we have over 20,000 Asian families in these neighborhood counties. Request your friend, somebody on your birthday when they come and cut the cake and say, wait a minute, I want to have this light and candle in somebody else's life continue going, then blowing away. Because God does not wait. You can have that light go on, and you can have more birthday candles if you could contribute. Don't accept any gift on your birthday for next 2 years, but give $500 per husband and wife, $500 for a family of 4, but believe me, in 2 years, you'll have $1 million. And Kiran, I have one special surprise for you. By this time, next year, if you don't reach a goal for $600,000, I'll make up the difference. So you don't have to wait forever, but please donate generously. And if you do make it, I'll still give you $100,000.
Ladies and gentlemen, Mr. and Mrs. Atul and Lata. Well, now I know, and we collectively know, that the health center is going to be a real one. We don't have to wait for it. We have the funding. Awesome. Thank you very much. I'm going to invite Ritesh Shah to introduce Assemblyman Herb Conway. Ritesh.
I'll make sure I'm very brief. It is my distinct honor. Sometimes things work out in a unique way. When Assemblyman Herb Conway called me literally about an hour ago, and Senator Gopal was not going to come here, he took the invitation and drove 1 hour just to come. Assemblyman Dr. Herb Conway is the chair of Health Committee in New Jersey General Assembly. He has been providing service for over 21 years. And an attorney and physician himself who understands the importance of these healthcare services. Without further ado, Dr. Herb Conway.
I have to put this in the holder because I tend to move my arms around a little bit when I speak. But it is a distinct honor and pleasure to be with you this evening and to hear of the wonderful work that's being done on behalf of so many who are in need. It is a great thing indeed to give of oneself to help others. And in my view, I'm a physician I've spent most of my life practicing medicine, internal medicine, taking care of people in an inner city, that is Trenton, where I see people come in every day who are bereft of health care and come to me very often with a disease state that's moved far beyond where it might have been if they had had access to primary care, preventive care, someone to check test their blood, to give them advice as to diet, to inquire of them about any symptoms that might be untoward so that they can go on for further and definitive care. This service, and just think about 12,000 people. Think of all the other people that are connected to those 12,000. The sons, the daughters, the mothers, who now have the opportunity to be with their loved one longer because some disease, chronic condition very often, was treated and managed so that that person's life, valuable as it is, can be extended to keep together with their family. So this, the privilege that you have of serving is very important, but you understand how important it is to the individuals who have been served. It's a great thing to serve, and it brings, 21 years, actually 26 years almost, in service in the General Assembly, FQHCs in my purview as a health chair. It's been my honor in two arenas, both as a physician and as a legislator, to help advance the health care of the people who live here. The work that you do strengthens our state, strengthens our communities. We are a diverse state, and we welcome everyone as we should, and we are better because of the great work that you all are doing, and certainly the generosity that will make this next stage in the life of this center even better and stronger, and there to deliver health services to so many who are in need. I know it will be a success. I congratulate you in advance for the success that I know you will bring. I'm here, as my friend Ritesh mentioned, on behalf of my very dear friend Vin Gopal. Vin actually, Senator Gopal now, actually got his start in politics in my office when I ran for Congress back in 2005. And he's gone on to do such great things, and I'm very proud that he's my friend. I'm proud to be just a little bit a part of his start in politics. But I'm here to present this resolution presented here from the state of New Jersey to congratulate the health camp for the great work you've done for now 25 years. Congratulations.
Assemblyman Conway, we're going to take you up on your offer because I'm sure you have phenomenal expertise on how to get the FQHC. So we will definitely reach out to you for your help. Now, I know you came here to listen to the music also. And if I was sitting where you're sitting, you probably want me to shut up and start the music program. Right? So I urge you for maybe 2 to 3 more minutes because I do need to recognize 2 sponsors and a couple of special individuals. So in addition to, there are 2 special sponsors that we want to recognize. Gold sponsor, Dr. Jagdish Yalamanchili of UBlood. Are you here? If you can please, I think someone is here from your organization. If you can please come forward. They do some very special work, and they have been a big donor and sponsor for us, and we want, thank you very much. We want to present a plaque to him. Tushar Patel is there to present the plaque. Oh, he's walking right behind him. Good. And I request our executive committee members, Dr. Nirali Patel, Shirish Parekh, and Dr. Rajesh Thakur to present the plaque. Thank you. And thank you very much. And I told you I'm going to speed things up. So the next sponsor is Geeta Fufandi, CEO of Faith Home Healthcare. If you can please come to the stage. Thank you. And giving out the plaque to her is Ritesh Shah, Dr. Sefali Patel, and Jigisha Kothari. If you don't mind, I'm going to just call you Geeta. Geeta has a healthcare company, and they are a leading healthcare services organization in New Jersey. And they provide many, many services and are about to start hospice care for our community. So thank you very much. There are some dignitaries in the audience that I want to recognize. Somerset County Commissioner Melanie Morano is here. Thank you very much for joining us. Mayor of Bridgewater Township, I think he was also already mentioned, but Matthew Match is here. Bridgewater Council President Michael Kirsch is here. Michael, please. And we are very happy that two of our own community leaders, Padma Shri Dr. Sudhir Parikh of Parikh Worldwide Media, he's been a great sponsor and he's here in attendance. And I think Mr. H.R. Shah, another Padma Shri of our community, which is a phenomenal award to have, is Mr. H.R. Shah of TV Asia. Please give them all a big round of applause. In addition, we do have a representative from our Consul General of India. Mr. Bijender Kumar is here. Please, thank you very much for coming and supporting us. And since we are sitting in Bridgewater, it would be unfair not to have our Mayor Match to say a couple of words. Mayor, can I request you to say a couple of words?
Well, good evening, everyone. I think I may be the only thing standing between you and music, so I will keep it brief. I just want to start by saying thank you to everybody who has participated in this organization over the past 25 years. When you hear where people have come from geographically, we might be in Bridgewater, and of course we're honored that you're here in Bridgewater, but this organization and the work that it's done touches communities and families throughout New Jersey. We have folks here from Middlesex County was here. We have Passaic County Commissioner John Bartlett is here, all the way up from down from Passaic County. We have our assemblyman, coming up from Trenton. It is an organization that reaches so many people all across New Jersey. So thank you for everything that you all do. I sat next to my Julia, my 6-year-old is here. My other kids are as well, but sitting next to a 6-year-old doing a program like this is always interesting because they ask questions as you go. And it's amazing sometimes the questions that a 6-year-old asks when you're hearing people speak. And so she asked me first, she said, Daddy, why does God make diseases? Why are people get sick? I don't know how to answer that one while we're sitting here. And then she says, well, why don't people have insurance? Why can't they go to the doctors? I don't know how to answer that one either. And then she turns to me and she says, Daddy, so before when you're talking about a family of 4, she says, well, Daddy, as a family of 5, how much money are we supposed to give? So, in that spirit, we will be making sure that our family makes a donation as one of the first families towards that initiative over the next couple years. And her last question is, Daddy, when does the music start? So with that, thank you all for your service, for being here. God bless you, and keep up the work for another 25 years.
I think I want all of you to bring your 6-year-olds here. This is fantastic. I mean, I don't have to say a single word. It just happens, right? Well, this is the last item on my list, so, okay. Yeah, I know. I mean, I guarantee you, I will be done after this, okay? And I'm not putting pressure on our next guest when I'm saying this, but I want to invite our guest of honor, Commissioner John Bartlett. of Passaic County. Please come forward. John is a Deputy Director of Passaic County Board of County Commissioners. As a County Commissioner, John strives constantly to ensure that language, culture, and immigration status are never a barrier to accessing county services. Ladies and gentlemen, John Bartlett.
Thank you so much. It's an honor to be here, and I am well aware that I stand between you and the music. So I'll be very brief. Belated Happy Diwali to everyone, and Sal Mubarak. Sal Mubarak to my Gujarati Bayo and Beno. A lot of you know my wife, Dr. Khyati Joshi. She couldn't be here tonight. If she were, she would probably caution me not to traffic in the model minority myth. But as somebody who's been watching this community as a married into it member of it for so many years, I have to say, for a group of people that 58 years ago were not even allowed to come into this country, the Indian American community has stepped into leadership in medicine and public service like almost no one else I can imagine. And I think the Indian Health Camp, the Health Camp of New Jersey is such a great example of that, because you have figured out what a lot of my fellow local elected officials here, the mayors, the county committee, the county commissioners, the council members have learned, which is that something doesn't have to be complicated to be consequential. Something doesn't have to be difficult to make a profound difference in the lives of the people that you serve. And it's remarkable. I feel as though that 12,500 number that we've all been hearing is just a start, because the next quarter century of this organization is going to be extraordinary. And I thank all of you for being part of it.
I assure you I will not be back on the stage again, okay? With that, guess what? We're going to start the music. Are you ready? Yeah, I know you've been ready for half an hour ago, but thank you for your patience. You know, it was important that everybody gets the message that we are trying to convey. Thank you. Enjoy the music.